I'm Dr. Aurora Gloria Libadia, Clinical Associate Professor of the University of the Philippines, College of Medicine, Department of Pediatrics, Division of Newborn Medicine, and I'm currently the head of the Philippine General Hospital Human Milk Bank Center. The Philippine General Hospital Department of Pediatrics protect, promote, and support breastfeeding. For the welfare and health of the Filipino children, please do not break the milk code. There should be no promotion of breast milk substitutes, breast milk supplements, feeding bottles, teats, pacifiers in health facilities with maternal and neonatal care services. We as healthcare providers should not request nor accept from milk formula companies and their representatives gifts of any sort, samples or products covered under the Code of Marketing of Breast Milk Substitutes, posters, other promotion materials, or direct promotion of products covered under the code within your health facility, community, barangays, and other events. Sponsorships without permission from the Interagency Committee or the IAC approval. Let us inform people about the importance of breastfeeding. This is the healthiest start in life, the first food security system, the foundation of life. It's a form of human rights of both the mother and child, the number one intervention to prevent child death. The milk with full of love and full of antibiotics prevents infection-related death due to diarrhea, pneumonia, sepsis, prevents all forms of malnutrition, including obesity. It increases intelligence scores, prevents non-communicable diseases like cancer, diabetes, hypertension, allergies, asthma, prevents severe uterine bleeding, breast and ovarian cancer, and postpartum depression. Easier to get back to the pre-pregnancy weight. It's also a form of contraceptive, and there will be more savings for the family that would help the economy of the country as well. Let this be known. The risk of infant formula. There would be interference with bonding, more infection like diarrhea and respiratory infection, persistent diarrhea, malnutrition, more likely to die, more allergy and milk intolerance, increased risk of some chronic diseases, overweight, lower scores on intelligence tests, and for the mother, increased risk of anemia, ovarian and breast cancer, and may become pregnant sooner. The Philippines have had fair share of disaster, whether natural or man-made. But please remember that during disaster, the best emergency preparedness is a confident, well mother capable of nourishing her child, exclusively breastfeeding from 0 to 6 months of age, and start the age-appropriate complementary feeding from 6 months and continue breastfeeding up to 2 years and beyond. The best emergency response is one that works with her to protect and support her confidence and capacity. Breastfeeding provides the cleanest and safest form of young child nutrition in disaster situations and in the normative standard for infant nutrition. So in this COVID-19 pandemic, please perform Unang Yakap or EINC. The following newborn care practices would save their lives. Initiate breastfeeding within the first golden hour of life or 60 minutes of life once with feeding cues. Rooming in and the non-separation of mother-baby diet regardless of their COVID-19 status. Healthcare workers and mothers should perform proper hand hygiene and wear appropriate personal protective equipment. Because the separation of mother-infant diet results in decreased infant protection against infectious disease, overburden of an already overwhelmed healthcare system to care for separated infants. There would be negative impacts on maternal physical and mental health from separation and disrupt biological and emotional bonding. So in this COVID-19 pandemic, continue exclusive breastfeeding and kangaroo mother care for stable, premature, and low birth weight infants. Mother who is COVID-19 suspect or confirmed should maintain the use of face masks and perform frequent hand washing, cough and sneeze into a tissue, dispose immediately in proper bin, and disinfect frequently handled surfaces like cellular foam, doorknobs, and others. Please take note that breast milk is not a vehicle for COVID-19 virus transmission. It is safe to receive COVID-19 vaccines among lactating women. And the evidence showed that COVID-19 antibodies are found in the breast milk of infected women, as well as those mothers vaccinated against COVID-19 virus. The Human Milk Bank is a service established for the purpose of screening, collecting, processing, storing, and distribution of pasteurized donor milk to meet the specific needs of premature babies and sick neonates. For mothers who have extra breast milk, please donate your milk. Your milk could save these newborns. But please remember that the pasteurized donor milk would only serve as a temporary solution to provide neonates with no access to their mother's breast milk, accessible only with a physician's prescription. If a new vaccine became available that could prevent 1 million or more child deaths per year, which is cheap, safe, and administered orally, and no cold chain is required, it would become an immediate public health imperative. And breastfeeding can do all of this and more, but requires its own cold chain of support. Support from her partner or husband and the rest of the family members, her trusted healthcare provider, her friends, the community, the mother support groups, her employer, the government, NGOs, and medical societies. Tulong-tulong tayo to protect, promote, and support breastfeeding. Thank you for listening. And please keep safe, everyone.